Hello everyone, I am Dr. Advait Kulkarni. Hey doctor, why my headaches are only on one side? I am not able to understand. Why don't they involve both the side? Why it's always on the right side or sometimes it is on the left side? This is a common scenario and a common question my patient asks. Why some of the headaches affect only one side of the head? Headaches can be very complex and sometimes very perplexing. Headaches can happen because of various reasons. So, we will be discussing what are the different kinds of headache and what are the causes of one sided headache and when headaches can be serious. The most common cause of one sided headache is migraine. Migraine is any episodic headache which is severe to disturb your daily routine. It is often associated with light sensitivity, sound sensitivity. The person cannot see bright light, cannot hear loud sounds, wants to lie down in a dark room, and it is sometimes associated with a nausea or a vomiting sensation. Headaches are one of the most common lifestyle headaches. The second cause of one sided headache can be a tension headache or a stress headache, which typically happens because of late night awakenings, stress, prolonged screen time, etc. A third and a very disabling cause of severe headache is called a cluster headache, which is often associated around the eye and around the temporal area. It is an excruciating pain which is very severe and also wakes up a patient from sleep. It happens in clusters, so it may happen for just a few days in a year and typically is very disabling and lasts for only up to 3 hours. So right sided headache can be because of these lifestyle causes, lifestyle headaches, that is a migraine or a tension headache or a cluster headache, or rarely it can be because of some other issues in the brain. I remember last week a 25-year-old gentleman came to my clinic and said, "Doctor, I never used to get headache in my life. And now from 10 days I am getting a headache on right side. It's a severe headache and I am vomiting daily, doctor. It is increasing day by day. Every day the intensity of headache is more. And moreover, now I am experiencing blurring of vision. Whenever I am seeing in the front, my vision is blurred. And this is the signs of the serious headache. These are the red flags of a patient who comes with headache. That is a new onset headache, a patient experiencing daily persistent headaches which are increasing in intensity and severity, a headache associated with severe or daily episodes of vomiting, headache associated with blurring of vision or double vision, headaches which are severe enough to disturb the sleep, and headaches which are associated with other neurological symptoms like seizure episodes, one sided weakness, or loss of consciousness. So, these are the red flags. But if somebody is experiencing one sided headache, it automatically doesn't make him prone for a serious condition. Most of the cases, one sided headache can be caused by migraine or tension headaches or cluster headaches, as we have discussed. It is very important to understand the root cause, and the lifestyle management is a key factor in the treatment of headache. Hey, doctor, I'm experiencing severe headaches which happen again and again. I'm really worried. Do I have a brain tumor? Oh no, boss. It may be just a lifestyle headache. This is a common scenario in my clinic where patient is often worried that a headache can be a cause of a brain tumor. It's very important to understand more than 95% of cases a patient who experiences episodic headaches which are severe is not suffering from a brain tumor. A brain tumor rarely presents with headache. More commonly, it presents with other neurological symptoms like seizures or a blurring of vision or double vision or episodes of loss of consciousness. But whenever brain tumor presents with headache, it can present anywhere in the head. Wherever the tumor location, it can irritate the part of the brain, the covering of the brain, and lead to headache. And these headaches due to brain tumors are typically showing red flags, that is increasing in intensity day by day, associated with vomiting or blurring of vision or double vision. They are typically worse in morning and they are generalized and sometimes located in the specific region. So it's very important to consult a neurologist and not to become a Google doctor and try to diagnose the condition yourself, because most of the times these headaches are likely to be lifestyle headaches and not related to brain tumor. Understanding difference between migraines and tension headaches is very crucial. Migraine headaches are typically one-sided headaches which are associated with vomiting and severe headache disturbing your daily routine. light sensitivity, sound sensitivity, and these are very disabling episodic headaches. Whereas tension headaches is often a band-like sensation around the head, which are dull pains which patient describes as heaviness. It is typically there for hours or days together, more in the evening, and patient can still work although the headache is irritating. So it's very important to understand what is the trigger in case of headaches. Maintaining a headache diary in case of these migraines and tension headaches is very, very important and very much to discuss with your neurologist. Understanding the root cause and lifestyle management is the cornerstone of treatment of these headaches. So cluster headaches are a distinct and severe excruciating pains which often affect one side, that is around the eye and around the temporal area. It typically wakes up the patient from sleep and it lasts for up to 30 minutes to 3 hours. It's a very intense pain and patient often experiences these pains in a clusters, that usually in few days in a year or few days in 6 months the patient experiences these pains, and these are recurring pains. These are often associated with autonomic symptoms like redness of the eye on one side, or watering from the eye, watering from the nose from one side. So the autonomic symptoms are typically distinct in these patients. It's very important to diagnose and treat these cluster headaches and to differentiate them from migraine, because the treatment is different. Although the lifestyle triggers can be similar, like lack of sleep and food choices, food triggers, stress, and exertion. However, it's very important to diagnose the cluster headache and treat it, because the emergency treatment of headaches, even oxygen therapy helps, which does not help in migraine patients. So these patients of cluster headache compulsorily do not need a painkiller to abort their attacks, and even oxygen therapy is of 20 minutes of oxygen, 20 liters per minute, can be useful to abort an acute attack of cluster headache. When should you seek medical attention for a right sided headache? If the headache is sudden and severe headache, which is happening out of a blue moon and you have never experienced this headache, a headache is persistent daily headache which is day by day increasing in intensity in spite of painkillers. Headache which is associated with red flags like recurrent episodes of vomiting, blurring of vision, double vision, or any other neurological symptoms like seizures or episodes of loss of consciousness. Headaches with fever can also be serious. So, if you are experiencing any of these red flags, please consult your neurologist and get yourself checked. It is very important to go to a neurologist when you are experiencing headaches, because these headaches are rarely because of sinus or a eye problem. So I see that patients often first go to an eye doctor thinking that it's because of the eye power, or they go to a ENT doctor thinking that it's because of sinus. But understand, whenever you are experiencing recurrent severe headaches, it's very important to consult a neurologist to save your time and energy. So I remember one of my friend's wife complained to me, "Doctor, I get headaches only on the weekends." I said, "Yeah, what is the reason?" But because my husband is at home. Of course, stress is a very important factor. What will not make somebody else stressed. So stress can lead to different kinds of headaches, of which migraine and tension headaches are common headaches. Typically, migraine leads to one side headache, and a tension headache leads to a band like sensation over the head. So now patients with tension headache sometimes also can experience one-sided mild dull aching pain, and the exact mechanism of stress induced headaches is less known. However, it is speculated to be because of changes in the blood flow and because of the chemical imbalance in the brainstem. So it's very important to manage your stress, and the first step in the stress management to have a good night's sleep. If you are not well rested, you will be stressed. So to complete your sleep, you should sleep early by 10 o'clock, and you should feel fresh in the morning, so that you wake up early by 6 or 6:30, and you can do some exercise. Keep your routine regular, and whenever you're hungry after waking up by 1.5 hour, you can eat your breakfast, which is a local traditional and seasonal breakfast, and then have your lunch whenever you're hungry by 12 or 1 o'clock. Have some snack by 4 o'clock when you're hungry, and finish your dinner early by 7 p.m. so that you can sleep by 10 p.m. Avoiding any screen in the night is very important. So, stress management is also about daily habits. If you follow the circadian rhythm, a biological clock, it is very easy to manage your stress. And not to add, more important is meditation, yoga, regular exercise, and practice of gratitude and mindfulness. Thank you.